You've moved to Chile and suddenly you have a fever of 39 degrees, sharp pain, or an injury. What should you do? Should you rush to a public clinic where the wait times are months long, or pay $3,000 for a simple appendicitis in a private clinic? Is health insurance required in Chile, or how can you avoid going broke from just one visit to the doctor? Today, I will explain in detail how the healthcare system in Chile works, what types of health insurance exist, how much they cost, and how to choose the best option for your budget. I promise, after this video, you'll know exactly how to protect yourself and your family without unnecessary expenses. Let's get started. So, how is healthcare organized in Chile? The first thing you need to understand is that healthcare in Chile is divided into public clinics and private clinics. Here are the key differences. Public healthcare is free. And to be honest, that's where the advantages end, because the main problem with free healthcare is the long wait times to receive services. Chile is no exception in this regard. But here's a life hack for you. If you live in a good neighborhood in Santiago, for example, Las Condes or Lo Barnechea, you won't have to deal with queues in public clinics, since most residents of these areas use paid private hospitals. And of course, you need to understand that only Chilean residents can use free healthcare. In other words, you need to at least obtain a residence permit. The second category is private clinics, private healthcare. Chile has a wide selection of private clinics, including the Alemana Clinic. This is the best clinic in Latin America, and it's located in Santiago. Private clinics, of course, are known for their high level of service and the absence of queues. The cost of an average doctor's consultation ranges from $30 to $50. Both Chilean residents and tourists can use private clinics without any restrictions. Now let's talk about health insurance in Chile, which can help you save significantly on your family budget. To use free healthcare, you need to obtain FONASA insurance. This is done by visiting the appropriate authorized office in person. You will be assigned the appropriate type of FONASA insurance depending on your income level within Chile. To use private healthcare with significant discounts, you can get ASAPRE insurance, which is paid monthly and allows you to receive substantial discounts at private clinics for all services, from 50 to 100% depending on the plan you choose. Usually, ASAPRE insurance is arranged through an insurance agent or online on the insurance company's website. Now let's break down how the health insurance system works in Chile and how it is paid for. In Chile, there is a centralized system for paying for health insurance. An employer, on behalf of their employees, or a self-employed entrepreneur for themselves, makes mandatory contributions to the pension fund amounting to 7% of their income. The employee or self-employed entrepreneur independently decides where to allocate these funds. They can allocate them to FONASA insurance or to ASAPRE insurance. If a person has no income, they will automatically receive FONASA insurance. If a person's contributions amount to a significant sum, it makes sense for them to choose to use these funds for ASAPRE insurance in order to benefit from discounts at private clinics. Contributions to the health insurance fund are mandatory. In other words, you can't opt out of this system, so you simply need to choose whether to use FONASA or to allocate this money to ASAPRE insurance. Let's break it down with a specific example. Jorge earns $1,700 a month. His employer is required to contribute 7% of this amount, $120, to the pension fund. Jorge wants to go to the private Santa Maria Clinic, which is located near his home, so he requests insurance rates from companies that specifically cover this clinic. The most favorable ASAPRE insurance rates were offered by the insurance company Banmedica, which proposed two plans: $120 per month with 70% coverage of services at the Santa Maria Clinic, and $160 per month with 85% coverage of the cost at the private clinic. Jorge decided to choose the plan with 85% coverage and submitted the corresponding application to his employer. Now the employer sends $120 each month to Banmedica, and Jorge pays an additional $40 himself every month, allowing him to use the services at the Santa Maria Clinic he needs with an 85% discount. Now that you understand the basic principle of how insurance is calculated, let's take a look at which ASAPRE companies are available on the market and what the average cost of their insurance is. The most well-known insurance companies in Chile are Banmedica, Colmena, Cruz BRD, and Consalud. The average cost of ASAPRE insurance for one person is about $150 per month, and it varies depending on the clinic, the coverage percentage, and the services included in the insurance. Maternity care is also included in the coverage. Therefore, if you move to Chile in advance, before becoming pregnant, as residents you can obtain ASAPRE insurance and give birth in a private clinic in Chile, either for free or for a small fee under the ASAPRE insurance. Our family uses ASAPRE insurance from the company Essential because this company offers the best terms for the Alemana Clinic, where we receive our care. Accordingly, we plan to have our third child at this same clinic. And at the standard price for childbirth for tourists at this clinic, the cost would be $15,000. But we won't pay anything because we chose the right insurance that covers 100% of the cost of this service. Now let's go over the pitfalls or what insurance companies don't tell you. Here are some nuances that you definitely need to remember and consider when signing an insurance contract. First, dental care is almost never included in the insurance. Second, there are limits on expensive procedures. For example, an MRI might only be covered up to 50% and surgery up to a certain amount. You need to clarify all of this with your insurance agent or the insurance company. Third, exclusions for dangerous activities. If you break your leg somewhere in the mountains or during sports competitions, the insurance most likely won't work. How can you avoid such problems? Well, or at least so it doesn't come as a surprise to you, always read the exclusions section in the contract and consult with your insurance agent. So let's sum up. Health insurance in Chile is not a luxury, it's a necessity. Without it, even something as simple as the flu can seriously impact your budget. If you have just moved and do not have any income in Chile, then sign up for FNASA. It's free. If you are working under contract, are an entrepreneur, or have started a business in Chile and are the director of your own company, direct your 7% to an ISAPRE and enjoy the benefits of private clinics at minimal prices. And be sure to read the terms specified in the contract with the insurance company. Need help choosing? Leave a comment under this video saying, "I want a consultation," and we will connect you with a trusted insurance agent who will help you get an insurance policy in Chile. Don't risk your health or your finances. Protect yourself the right way. See you in the next videos about life in Chile. Like this video and subscribe to our channel.